everyone, my name is Gangesh Shukla. I'm a fourth year medical clerk. Today I'll be performing breast examination. So we'll ask the patient to drape herself and we'll take the permission of the patient also. So now we'll begin with the inspection. So firstly we'll ask the patient to sit upright with her both hand on her thighs, and we'll look for any masses, scars, and then we'll look for skin changes like UV urine, or we'll look for any discharge. We'll look for any swelling, and if there any mass around the breast, and then we'll look for any obvious masses, swelling, or changes. Now we'll ask the patient to place both her hands behind the head, and we'll repeat the inspection, and we'll inspect for any breast tissue for any masses, symmetry, dimpling, or flickering. Now we'll ask the patient to put both her hand on her waist and lean a little bit forward, and again we'll check the breast tissue for any masses, dimpling, or flickering. Now we'll begin with the palpation. So we'll take consent from the patient, and we'll make sure to warm both of your hands, and we'll ask the patient to undrape herself till the waist, and make sure the position is lying on a 45-degree angle or flat on the bed. So we'll palpate the nipple first. Gently press the nipple for and look for any discharge. If there is any discharge, then look for the color, odor, amount, and the smell. Then we'll check for the areola. Gently press the areola and note for any masses. There are different methods to palpate the breast. Some are the clock face method and the spiral method. Here we use the spiral method. Using 3 fingers of your hand, we'll palpate the breast in a circular motion and check the levels of the tissues, and then we'll palpate first firmly to palpate the superficially, and then medially, and lastly deep to the level of the chest of the wall. Now we'll do the examination of the axilla. Palpate the axilla with a free hand, ensuring to cover all the areas of the axilla: the medial, lateral, anterior, posterior wall, and apex of the axilla. Gently check the nodes also: the cervical, the supraclavicular, the infraclavicular, and the parasternal. We'll ask the patient to drape herself, and we'll thank her for the cooperation. Thank you. Now we'll begin with the upper abdominal examination. In this we'll check the fundus height of the patient. So we'll take consent first from the patient. We'll put our hand on the Ziphus tunnel area and first locate the fundus. Then we'll put the tape and measure the fundus height. And whatever the value will become will be the fundus height of the patient. Now I'll perform the Leopold's maneuver. First I'll ask the consent from the patient. So I'll begin with the Leopold maneuver 1, which is fundus grip. In this, if there is any hard and palatable mass is present, then head is that. The second maneuver, Leopold maneuver, is the lateral grip. In this we'll check the position of the back, if there is a smooth surface is present, or the third is the polyp grip, in which we will check the fetal inlet into the pelvis and its mobility. And the fourth Leopold maneuver is the pelvic grip, in which we'll go opposite side of the patient, put both hands on the pelvis, and we'll check the fetal attitude and its extension into the pelvis. So now we are done with the examination. Thank you.